Dr. Merrill here in the Coates lab, going to teach you how to clean a Signia AX Pure Charge and Go. This is the newest product line of the Signia devices, of the RIC device, which is a receiver in the canal. So when you get your hearing aid, you will also have a cleaning kit with you, and I will go over what's in the cleaning kit. First, you have some alcohol pads. You have a microfiber cloth similar to what you use to clean glasses, a brush, and then some filters you may or may not use. So first, all you want to do is take the brush and wipe off this gray tip, which we call a dome. There is also a little pick on the other side that you can use. There's some little holes on the tip of these domes that you can kind of pick out any wax if there is any. You also want to take the brush side and wipe off the body of the hearing aid just to make sure that there is no debris. Most hearing aids these days are rechargeable, so there is a little rechargeable port you can also brush away to make sure that there's no debris in there for the contact of the charger. You can also, there's little holes here you can make sure are clear, and then the volume button, the up and down, you can kind of just make sure that there's no debris there either. Another option to do is take the microfiber cloth and just kind of have a better grip and wipe off any debris. It works the same way as the brush, just a little bit of a different method. You can also do that with the body of the hearing aid as well. If there is any sticky debris or wax that is on the tip, you can use the alcohol pads to wipe off that tip as well. If for whatever reason your hearing aid is not working and you know it is charged and you have cleaned it, underneath this dome is a filter. This little white filter can get clogged with wax. It is meant to protect the receiver from wax, so its job is to collect wax. If it is full, there will be no sound, so you would have to change the filter. So you have replacement filters. You take one out. You have an empty side, and then you have a new filter. So all you would do is you would put the empty side into the filter that's already in the device, pull up, this one will come out, flip the stick over, and here is the new one. You insert that right into the receiver. And for most patients, this will be the easiest thing to tell that it will now work again. And you can put the tip right back on. And overall, that is the cleaning of the Signia